My name is Dr. Adam Farber, and I would like to talk today about arthritis affecting the knee. In order to understand knee arthritis, you must first understand normal knee anatomy. The knee joint includes the thigh bone, or femur, the shin bone, or tibia, a small bone along the outside of the shin known as the fibula, and the kneecap, also called the patella. In addition, there are four main ligaments of the knee joint. The medial collateral ligament connects the thigh bone to the shin bone on the inside part of the knee. The lateral collateral ligament connects the thigh bone to the fibula on the outside part of the knee, and the ACL and PCL crisscross in the center of the knee. Also, between the thigh bone and the shin bone, there are two soft tissue shock absorber cartilage pads known as the meniscus. The meniscus on the inside part of the knee is called the medial meniscus, and the meniscus on the outside part of the knee is called the lateral meniscus. In this diagram, the kneecap has been removed so that you can see the thigh bone behind it better. This is a healthy appearing knee joint. The ends of the bones are covered with a smooth cushioned surface called articular cartilage. The articular cartilage is shown in light purple in this diagram. The smooth cartilage allows the bones to glide over one another easily as the knee bends with routine activities. The smooth cartilage also provides cushioning between the bones during weight-bearing activities such as walking, running, and jumping. This diagram shows a knee with arthritis. Arthritis refers to wearing out of the articular cartilage that normally covers the ends of the bones. In this diagram, instead of a smooth cushioned surface, you can see that there is erosion, cracking, and potholes within the cartilage surfaces. As the cartilage thins out, the smooth cartilage surfaces no longer glide over each other during knee motion. Instead, you begin to get bone rubbing on bone. This is painful and oftentimes is associated with a grinding sound. The wearing out of the articular cartilage in a knee with arthritis is similar to the tread on a tire wearing down over many miles of driving. On this slide, you can see the normal tread of a new tire on the left versus the worn-out tread of a tire that has been driven many thousands of miles on the right. These images show photographs taken at the time of surgery. The image on the left is of a normal, healthy knee. The articular cartilage surface of the femur, or thigh bone, marked by the letter F, and the tibia, or shin bone, marked by the letter T, are smooth and healthy. The image on the right shows worn-out cartilage on the tibia, or shin bone, marked by the letter T. There are some areas where the cartilage is completely eroded and there is exposed bone present. These images also show photographs taken at the time of knee surgery. The image on the left, again, is of a normal, healthy knee. The articular cartilage surface of the femur or thigh bone is marked by the letter F, and the tibia or shin bone is marked by the letter T. These surfaces are smooth and healthy. The image on the right shows worn-out cartilage on the femur or thigh bone marked by the letter F. There is significant fraying and irregularity of the articular cartilage, in contrast to the image on the left where it is smooth and healthy. These images show x-rays of a normal knee on the left versus a knee with arthritis on the right. In the normal knee, you can see a space between the thigh bone or femur marked by the letter F and the shin bone or tibia marked by the letter T. This space, enclosed within the red circles, represents the thickness of the normal, healthy articular cartilage. On the arthritic knee on the right, you can see that there is no space between the thigh bone marked by the letter F and the shin bone marked by the letter T. This absence of joint space is enclosed by the yellow circle. This lack of a normal joint space is due to the fact that the cartilage has been worn away and there is now bone rubbing on bone. Patients with arthritic knees typically complain of pain that is worse with weight-bearing activities, such as prolonged standing or walking. They may also complain of swelling, stiffness in the morning or after prolonged periods of sitting, and occasionally deformities such as bow-leggedness or having a knock-knee appearance. Treatment options for knee arthritis include conservative non-operative treatment measures or surgery. The appropriate treatment depends upon the severity of the arthritis, the symptoms experienced by the patient, and the patient's preferences. Conservative treatment options include avoiding aggravating activities such as prolonged standing or walking, and losing excessive weight so that knee experiences less stress. Using aids such as a cane or walker or knee brace may help to unload pressure off of the arthritic knee. This slide shows two pictures of a custom-fit knee brace that helps unload the pressure off of an arthritic knee. The arrows in the image on the right show how the straps and brace can provide compression to one side of the knee and thus unload pressure from the other side of the knee. This concept of using a brace to unload the worn-out part of an arthritic knee is shown in this slide. The image on the left shows an X-ray of an arthritic knee before the brace straps are tightened down. You can see that there is near bone-on-bone with almost no joint space in the area enclosed by the red circle. After the straps from the brace have been properly tightened down, you can see how the joint space increases in the same knee in the area enclosed by the green circle. Other treatment options for knee arthritis include taking anti-inflammatory medications such as Advil or Aleve that may help alleviate the pain and swelling associated with the arthritis. Knee injections such as steroid injections or medications called viscosupplementation may also help alleviate the symptoms associated with arthritis, but will not cure the underlying worn-out articular cartilage. Knee replacement is an option for patients who have exhausted all non-operative treatment options and are interested in proceeding with joint replacement surgery. This slide shows the appearance of a typical total knee replacement. The arthritic ends of the bones are cut off and replaced by metal and plastic components. A metal cap is placed on the bottom of the thigh bone, and a metal base plate is placed on top of the shin bone. A piece of plastic is positioned between the two metal components and replicates the articular cartilage. The image on the left shows the knee replacement components alone, and the image on the right shows the components in place in a knee model. For further information about knee arthritis, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com.